Senator, let me begin by asking about the bill that you filed in the Senate. Take us through that.
The bill aims to bring Massachusetts, and if enacted, will bring Massachusetts into compliance with the recommendations of the Centers for Disease Control, the American Academy of Pediatrics, and hundreds of medical and public health experts right here at home in Massachusetts. Specifically, the bill will require universal masking for everyone aged 2 and up, barring any medical or behavioral health preclusions. So there's an exception for those situations, very rare situations, but they do exist. Everyone, again, age 2 and up in early education and K-12 settings. The bill also provides for no attendance penalties for students who have vaccination appointments during school hours, and provides paid time off for parents and caregivers to take the kids to their vaccination appointments over the course of the upcoming year. And the bill would sunset at the end of the 21-22 school year.
The North Attleboro School Committee held a meeting this past Monday, August 2nd. No decision was made about what they will do when students do come back. There were a number of parents at that meeting voicing their displeasure on any requirements for their children to wear masks. What would you say to those parents?
People have a lot of feelings right now. A lot of us, all of us, I think, are really tired. We've been living through pandemic life for a year and a half now. We're going to be coming up on the 2-year mark before we know it. And this pandemic, COVID, is just not done. It's not over. It's not done with us. And this is, part of the nature of science, right? Nature of science is that the community, the scientific community, learns as it goes. And the Delta variant has so drastically changed the game, right? We know that Delta is stickier and can lead to much more significant and serious ramifications and health impacts. So we have to use every single tool in our COVID mitigation toolbox. And particularly where we have such a significant population of students who aren't even yet eligible for a vaccine, we have to make sure that we're putting masks into use. And I just have to say, Peter, I have heard from so many. I've actually lost count of how many parents and school committee members and local government leaders, superintendents, teachers, even some students as well, older students, saying, thank you. Thank you for filing this bill. Thank you for speaking up for science. Thank you for putting public health and safety first. And, I think we all have a similar goal of trying to make sure that schools stay open, that kids get to have in-person learning, that teachers can teach, in person all year long. And in order to do that, we have to make sure that we are putting health and safety first. And that's why masking is so important, right? This is not me coming up with an idea. This is me following the recommendations of the CDC, the AAP, and hundreds of experts here in Massachusetts.
What is the likelihood this will pass in the Senate? Is there a similar version in the House? And couldn't the governor just mandate masks in school?
Yep, he sure could. And I think it's particularly interesting that, as of the time that we're talking, just hours ago, the governor imposed a vaccine mandate on all staff at long-term care facilities, including the 2 soldiers' home facilities, which I just can't, while I agree with that decision, I just can't help but note the inconsistency with the decision about masking in schools, because one puts health and safety first and the other really doesn't. The governor does have a couple more weeks before school starts. He could easily change his mind and follow the science, which is what we should be doing and should have been doing the whole time. And the governor is the one with the resources to be able to actually implement this and provide the leadership that all of our folks in local governments really need, and frankly have needed all along. But this is not the first time that our local government folks have been put in this particular situation by our sitting governor, including even the decision to close down schools back in March of 2020, when the governor waited until almost every single school district in the state had already decided to close before he took an action.
Likelihood of passing in the Senate?
I'm really excited by the number of really good conversations I've had with colleagues. The bill's only 2 days old at this point, so things move really rapidly, and I'm really grateful to be having some deeply engaged conversations with colleagues over the last couple of days and in the days to come.
Has anyone filed anything similar in the House?
No, not at this time.
So if the Senate were to pass it, but the House would not take it up, would it die? I'm not real good at state government.
Sure. Happy to talk through that. A bill can come from the House side, it can come from the Senate side. Lots of bills are often filed jointly, basically the same text filed in the House and also in the Senate, but it doesn't really matter. You can move bills effectively through the same process regardless. So this bill filed in the Senate. It's a late file bill, so it needs to be assigned to a committee. That can happen in an informal session, which is where we are at this particular stage in the legislative calendar. It goes to a committee, it'll have a hearing date, and then it will move. Because it's a Senate bill, it should come back to the Senate. It would have to go to the Senate floor and then to the House floor, also to be taken up and voted on. If both the Senate and the House agree, then it goes up to the governor for his signature. And the governor, of course, could veto the bill, in which case it would come back down to both chambers, the Senate and the House, respectively, in that sequence, because it's a Senate bill, to override the veto. Now, that might sound like a lot of process, and that's true, right? And that's also by design, right? The legislative branch of government is specifically designed to be slower and more deliberate. The executive branch that the governor heads is the branch that is supposed to be and designed to be nimble and agile in order to respond to moments just like this one, where we have scientific developments that specifically tell us what we should be doing, even in schools, right? Which is an aspect of our communities that is directly regulated by the executive branch, right? This is a decision that should be made by the governor. But in his failure to do so, in his failure to follow the science, I just cannot sit idly by, knowing how many parents, teachers, everyone engaged in school communities that I've heard from, both before I filed the bill and also since I filed the bill, saying we have got to protect kids and communities come September, which is less than a month from now.
I'm an unenrolled voter. You're a registered Democrat. Charlie Baker is certainly a registered Republican. I thought he had been one of the most proactive governors in the nation. And hearing you say this, I'm thinking to myself, could this be because he has a potential candidate in the Republican primary down the road? Why do you think there's so much delay in doing this? You are right. He still has 3 weeks to make a decision. And we've all seen that the science does change from week to week. So I don't think you can blame him for not jumping the gun right now.
Well, with respect, Peter, this is not jumping the gun. This is sound science based on data-driven evidence and data-driven recommendations from national and statewide experts in public health, epidemiology, infectious diseases, immunology, and personalized medicine. So this is not jumping the gun. This is following the lead of widely respected scientists. And the governor could have made that decision last week, but he failed to do so. And also, with due respect, he has not been one of the prominent leaders in the nation when you actually stop and think about it, right? He failed to be a leader when it came time to make a decision about closing down schools. The rollout and then we saw gross inequities in the ways that COVID spread, right? Highly disproportionate impacts in communities of color and low-income communities, gateway cities like Attleboro, right? Attleboro was in the red zone for months on end, and the governor really didn't do anything about that. Then the vaccines came, and more disparities and inequities perpetuated, to no shock at least no shock to me. And now here we are yet again, seeing another failure of the governor to lead in a moment where he really needs to step up to the plate rather than, I hate to mix my sports metaphors, but he needs to step up to the plate rather than punting the COVID football. And that's exactly what we've seen yet again. As to why he's made this decision, you'd have to ask him.